in Yavapai County. I actually live north of Prescott in a little town called Paulden. My wife and I have been up here in Yavapai County for about 8.5, 9 years now. Some of you may have known me when I was with Humana. I joined Devoted just about 2.5, 3 months ago. So really excited about what Devoted is doing in Yavapai County and the opportunity to work with all of you again, and some of you for the very first time. So just as a high level, just to give you an idea of what we're going to accomplish today, we're not going to get really deep into the weeds. We really want this to be an opportunity to talk about the benefits that Devoted brings to your patients and our members, our concept, some of the things that really make us different, make us stand out amongst some of the other MA plans, and as well kind of give you a little bit of a taste of what's to come. So with that being said, Rachel, if you could advance to the next slide. Awesome. So our coverage area, our team, we're going to talk through some of that, but first we'll start here. Thanks. You're all over it, Rachel. We'll start with a presentation from one of our founders.
Far too many seniors don't get the best healthcare in the world. The problem is that the healthcare system as a whole isn't systematically wired to support doctors and nurse practitioners and other care deliverers to get people the best care in the world. Devoted's mission is to change all of that.
When you look around and you look at what's happened in the last 20 years, you see enormous changes that have been made in other industries. And then you look around at what's happened in healthcare, and it's like nothing has changed. We're stuck in the Stone Age. It is time for something different. It's time for a different kind of company to go forth and bring that kind of innovation to healthcare.
The reason we're in this business is so that we're solving problems for who we're serving.
So we have hand-selected a very high-performing group of primary care physicians.
Ending up with a smaller primary care network that has a backbone of a very large, high-quality specialist network, as well as a high-quality hospital network to work with.
Healthcare will always be about an interpersonal relationship between a doctor and a patient. And what we're trying to do is allow like the human interaction to really lead.
Across every industry that we're seeing being disrupted, there is one common element. They're all using new technologies.
Because we're taking technology that other kinds of consumer companies have been using for a long time. We're applying it in a space that has been using technology from the 70s.
Why do we need Devoted Health right now? It's the first time we've been able to actually put together the pieces that actually allow you to have a world-class patient experience.
No one's a number here. We want to develop that personal touch with each of our members to ensure that they are getting the care they need when they need it.
So we're very excited about where we're going, and we're absolutely freaking out of it.
Thanks, Rachel. So I'm going to read this because sometimes it's better to just try to read slides. So our mission, we are guided by a single, firmly held belief. We want to treat every member like family with loving care and a profound commitment to their health and well-being. And that is a big mission. You can't accuse us at Devoted Healthcare of having low expectations for ourselves. But I'm really excited to tell you that in the short time that I've been here, and we'll go into some of the detail about why this is so, but in our role within Devoted Healthcare, there are times when I literally watch this mission be played out in front of us in our IT systems to have impact on patients in minutes for questions that often I used to see would take sometimes weeks to resolve. So really excited about this. At the end of the day, what this is about is people. It's about taking care of our neighbors, our family members, and so forth, again, as the number one priority. So I want you to start thinking right away of a collegial approach to this. This is a health plan that wants to work with you, not against you, that wants to be a true partner in the best sense of the word, as we all work in this really complicated environment to bring the best care to the patients and members that we all serve. So Rachel, if you can go to the next slide. Some of the things about us that are different. when the founders built this company, rather than going and taking the investment money that they had, some of you may or may not be familiar with an EMR called Athena. And that was founded by the Park brothers, who are the founders now of Devoted. Rather than buying an existing health plan, they decided to build one from the ground up. And what they did in that process is they built a self-contained IT system. I'm not an IT guy, not even close. But the neat thing about our system is that everything's in the same space. So whether it's claims or provider representation or customer service or credentialing, contracts, all of these things are in the same IT system, which gives us the ability to go in and solve problems much quicker. As you may or may not know, a lot of times larger health plans will use vendors. So they use a vendor for credentialing, they use a vendor for claims payment, et cetera. And so you're often would send an email to somebody, or you reach out to somebody, maybe it's a day or 2 or 3 before you hear back from them. Meanwhile, your need, whether it be the provider or the member, is waiting. So one of the things that so because of this system, it's given us the ability to do some of the following. So we can usually credential providers in less than 20 days on average. We process standard auths in 3 days or less. And one thing that's exciting, I'm going to steal a little bit of Nicole's thunder, but we're not going to have referrals. You will not need a referral in Yavapai County, and I'm super excited about that. We also adjudicate 90% of our claims in 3 days or less, with funds being in your account usually in 5 to 7 days. So we're paying much quicker, which is a benefit, obviously, to the end user, because now the money is in your bank to pay your staff, to pay your expenses, rather than kind of just in Neverland. We answer 80% of the member calls in under 30 seconds, resolve more than 80% of the member issues on the same day. Something that really spoke to me, as some of you that have worked with me in the past know, I worked in behavioral health in Maricopa County for quite a while, and then senior care and long-term care for Medicaid. Customer care, patient care, member care is a huge passion to me. One of the things that I'm so excited about working with Devoted and the commitment they have made to their membership is the expectation they have for our health guides. You can think of them as a customer service person, but they really are so much more. And our health guides are not mandated to hit a certain number of calls per day. What they are judged on, what their goal is set on, is resolution. So because of that, patients have the opportunity, if they need to speak to somebody for several hours, if that's what it takes to solve the problem, then our team is committed to that. So very excited about that as well. And we apply that same level of commitment to you as our providers. Devoted Healthcare reached out to me and said, hey, we'd like you to come to work for us. And after a couple of conversations, man, I was sold. So one of the things that I like to tell people is in Yavapai County, you also have me. So you'll have my cell phone, my email address. I'm here to help support you as, again, you take care of your patients and our members. So on the next slide, Rachel, the coverage, we can go to the next one. So where we are currently, well, I should say in 2022, I don't know about any of the rest of you, but I still lose a year. I still try to call, I'm off a year because of COVID. So, but we currently are in Maricopa County. We're going to be coming into Pinal County and Yavapai County in January of next year. So we're about to enter our first annual election period in Yavapai County coming up very soon. We're all super excited about that. So next slide. And then I say I am Devoted Healthcare for you. That means that I'm the person you can call, email, text to get a response, right? It doesn't mean that I actually do it all. Thank goodness. So we actually have an incredible team. In the next slide, you can see our founders, Ed and Todd Park. I encourage you to Google them. There are some awesome videos out there of them just explaining not just the passion that they have for what they want to do and what Devoted Healthcare can be, but also just for the love they have for each other. And I don't use that term loosely. They really do care about one another. It's exciting to see how they collaborate in this company that they've built. And then on the next slide, you'll see some of our local leadership. And I want to call out, first of all, Nicole Blue, who's going to walk through all of the benefits. Nicole works out of Maricopa County, but has really already committed so much of her time and energy to Yavapai County. Has just been a tremendous asset to me in this county. I love the fact that I work for a company that if I need to, I can reach out to Keith, our market president, or Rick, our vice president, or Dr.
Mike, I think you went on mute.
So sorry about that. I don't know how that happened. I was just saying that it's been such a pleasure to work with this leadership, and so that you guys know we have access. I have access to Dr. Rivlin, our medical director, if we have a question about a clinical issue or some other things. So really excited about that. You're going to get to meet Nicole. I'm probably repeating some things here, and then our president and vice president, Keith and Rick, are both just tremendous. They've been in this field for 20 plus years and are great resources, and definitely are here to help me serve you. In the next slide, we'll talk some about the network team. So Tiffany Turner is our director of network performance. So when we talk all things risk adjustment, quality, Marcia, I know that's something you're very familiar with in our conversations that we used to have monthly. So same kind of a concept. We're all looking for the same information. Tina is my direct supporter. She's my boss, but I tell you, working here, you just feel like everybody is pulling for you. So that's awesome. And then Tyler Bristol is a network representative, and he works kind of behind the scenes a lot of times. It helps us solve problems and get resources for the network. All three just very valuable team members. And then the next slide. So this is the network manager group. Sheila Patel, Rebecca Joyce are in Maricopa County. Rebecca and I have been friends now for quite a while, and actually she's part of the reason I'm here at Devoted. So big thank you to Rebecca again. Sherry Witherspoon has been pivotal in helping to built the Yavapai network for the providers. So, and she continues to support me and help. And then she's also, on top of that, launching Pinal next year. So really excited for all that she's done. Just again, tremendous team. And then Alexis Dunn is another network representative that has just recently joined us. So similar to Tyler's role. And in the next slide, I believe there's the team that's going to help us grow the membership. So Kim Byrne has actually worked with a couple of the providers up here already about some marketing. We really are excited about this plan, and we really do want to make it available to as many members, to as many people in the community as possible. So would love to have conversations with all of you, if at all possible, about how we can get the information of the plan out into the community through your offices, how we can work with you, again, collaboratively, to get more membership for your practices, and quite honestly, for our plan, we think that we're going to be able to provide better care in a lot of ways, and we're going to scratch the surface a little bit on that today. And then Nancy Go is the Chief Marketing Officer, and Linnea Connolly is a Provider Awareness Team. And then on the next slide, so there's even more. I just felt like the infomercial, but wait, there's more. We also have additional teams that are here for you. But again, I just want to press the fact that we have a lot of people here to support us. We are planning on this plan being here for a long term. As you all know, I've lived here myself again for quite a while. We've watched plans come and go in this community. That's not what Devoted is about. Devoted is about sustainability. We're about being able to provide a good platform for the membership, for your patients, so that we can work with you, your clinical teams, your quality teams, et cetera, to provide the resources that are going to lead to better health. Because that's really what this is about. This isn't 1970 HMO where you deny. This is all about improving health outcomes for the patient's quality of life, and to work with you guys and your organizations to provide those kinds of services that are going to help them get there. So in the next slide, we have clinical guides, and this is real similar. A lot of you that have been in this field know there are folks that we can get connected to patients when they're struggling. Maybe they need a little extra support, and this is the kind of thing too that you can help us identify. So we used to have conversations with YRMC, for instance, on a monthly basis about clinical issues, patients that were struggling, patients that needed to see a doctor, patients that were having trouble getting whatever maybe resources for their homes that would have helped them be just a little bit healthier. So those types of physicians or that type of assistance is also available for you. And then on the next slide, support teams. So again, because of our platform, for instance, I had a question on a pharmacy issue that one of my providers had. And so I went to, we have a system called Slack. It's an internal messaging system. I went to a pharmacy team help spot, entered my question, had the answer in real time. Before I ever left the office, I was able to let the provider know the answer. So that's the kind of service that I think we'll be able to continue to drive and really help you guys keep moving forward. So just at the top, we've talked about member guides, provider service rep. Again, all things devoted. I want you to think of me. I don't want you to have to go into a rabbit hole if at all possible. And then the pharmacy team, our sales and marketing team, our provider performance team, and STARS and HEDIS. So we really are excited about the group, the teams that we've developed. The folks that I work with are just the best of the best. I mean, it's just amazing. Every time I'm on a conversation with somebody, the years of experience or just the strategy, the history that they bring, the resume they bring to this company has really been quite impressive. And then the next slide. So I'm really talking fast today. I had a lot of coffee this morning, sorry. So we have the amazing Nicole Blue, who's our sales director for the state of Arizona, and she's going to walk through the plan benefits or the plan highlights for 22 in Yavapai. Hi, Nicole, thank you.
Thanks, Mike. Can you guys hear me okay? All right, perfect. All right, so let's go ahead and get started. As Mike mentioned, my name is Nicole Blue, and I am the sales director for Devoted Health here in Arizona. And I'm really, really excited about our entry into Yavapai County. As Mike said, I have been up there quite frequently. In fact, I'm driving up there right after this call to meet Mike to give him some stuff to pass out to offices. So really excited for that. So let's go ahead and jump into what we're actually bringing up to Yavapai County for 2022. On here, you will see the 3 plan options that we will be rolling out starting on Friday morning. We will have our Devoted Core Plan, which is our 0 monthly premium option. So nothing that anyone has to pay for this plan on top of their Part B premium. Very rich benefits with very rich supplemental benefits and dental benefits. And then we have our Select plan, which is our plan that's really tailored for those individuals that are low income. So I want to make sure you understand this is not a dual Medicaid access plan. This is a plan tailored for those who are on the low income subsidy program, but also a very attractive option for individuals who are willing to pay a premium to get reduced benefits and some additional supplemental offerings. And then lastly, we have our Advanced plan, which is a chronic special needs plan for individuals with either type 1 or type 2 diabetes. We will be going deeper into these benefits here shortly. So let's go ahead and go to the next slide, please. All right, so here you will see a grid of what those benefits look like. So I'm gonna go ahead and just start with the core plan and go down with the highlights. The core plan, again, as I said, is a 0 monthly premium option. Now, this option is very attractive because, of course, we're going to provide 0 PCP visits always and low specialist visits at $20. One thing that I'm really proud of Devoted is our inpatient hospital copay up in Yavapai. When I look at what the competition is doing, we blow it out of the park with this inpatient hospital benefit. So $175 a day for days 1 through 7. If they're in there more than 7 days, there's no additional cost for them. Low out-of-pocket expenses for ambulatory surgical centers, $75. You can't beat that. And of course, $0 for copays, $0 copays for your lab services and your x-rays, and $0 if you have advanced imaging, so your CTs, your MRIs, your PET scans, as long as it's done at a freestanding contracted facility. Let's go to the next one. Here is the Select. Oh, go back one more slide. I'm sorry. Oh, keep going. Thank you. The Select plan here is the middle column. This is that plan, again, that is for those who have the low income subsidy plan. So that is a federal program for individuals who meet a certain income threshold. And this plan is really attractive because while it does have a premium, that premium is subsidized for individuals who have that low income. Now you will see here that for 2022, the premium says to be determined. Medicare did just release the low income premium subsidy amounts, I think was late on Friday. So that will be about $40. Out of pocket maximum $3,400, but look at that specialist copay, $5 to see a specialist, $150 a day in the hospital, $25 for ambulatory surgical centers, and $0 again for those labs, advanced imaging, and x-rays. Now you will see that for the prescription drug coverage, there is a deductible for tiers 3 to 5, which are going to be our brand name medications. But keep in mind, if an individual does have that low income subsidy program, they do not have to pay deductibles and they are exempt from the donut hole. And next, I'm going to go over the advanced plan. Super excited to bring this plan up into Yavapai. This is really designed for those individuals who have diabetes. And again, no monthly premium for it, $0 to see specialists, endocrinologists, and podiatrists, $15 to see all other specialists. So again, this is really tailored to meet the needs of those individuals with diabetes from a financial standpoint, but also access to care. There's a lot more that we do offer on this plan, which I will go over shortly, that's really tailored for those individuals to help them through their healthcare journey. Now we can go to the next slide, please. All right. Now, one thing I did fail to mention on that advanced plan that's super important is that we are participating in the senior savings model. So that is a program that allows us to provide insulin to diabetics at $35 a month. And that includes through the donut hole. So super important for those individuals who are taking insulin to look at this as a plan option, because when they hit that donut hole, they're typically paying 25% of the cost of that insulin, which, as you all know, working in this field can be very expensive. We will continue to offer their insulin at $35 for them, even in the donut hole. So huge cost savings. So let's talk about some additional benefits we have on all three plans. I want to bring your attention to dental. We all know that dental plays a huge role in the overall health of our seniors today. And too many seniors are suffering from chronic conditions and other health issues because they're not taking care of their teeth. Either they just don't have access to the right dental, or perhaps they don't have the funds for it. We want our members to get care for their dental. So all three of our plans will provide preventive dental. So that's their routine cleanings, x-rays, and exams at no cost to them. On top of that, on all three plans, we're offering very, very high dollar amounts in comprehensive dental. $3,000 in comprehensive on the core plan, $5,000 on the select, and $4,000 on the advanced. What I want you to remember is this is first dollar coverage. So there's no co-insurance they have to pay. There's none of this, they pay 15% or 50%, we pay the rest up to a certain amount. It's first dollar coverage. So super, super important that individuals know this. We're really touting this benefit with our brokers, making sure they're aware of it, because this will help individuals' overall health so significantly. You will see we have a very attractive hearing aid benefit on all three plans. We have premium hearing aids and advanced hearing aids. What I want you to know about that is we go above and beyond just the device itself. We do provide a 60-day a trial period, essentially. So within 60 days, if they don't like it, they can get a full refund. We have extended warranties. For those hearing aids that have batteries, we're providing up to 80 batteries for those devices. We provide visits at no cost to the audiologist post once they get those hearing aids put in. So again, it's so much more than just the device. It's providing service and experience around it. Speaking of providing service, the personal emergency response device, super important that every senior has one of these, right? Even if they have really good balance, falls happen, and we want to make sure that all of our seniors are able to get care when they need it most. So every single member on a Devoted Health plan will be eligible to get a PERS device. So next year, really cool, they're not those big bulky pendants anymore. They have a watch that looks like a standard fitness tracker. They can call or push a button there and get connected to LifeStation. It also tracks their steps, and it has alerts for their text messages. So really, really neat. There's also an option that looks more like a pendant for a jewelry, like a little jewel stone that they can press and get connected. We cover this at no cost to our members, and we also do provide the subscription fee for them. So they don't have to pay anything. Super important that they get this. Also very excited about transportation up in Yavapai. We spoke to a lot of providers and a lot of brokers prior to making our official entrance into Yavapai County and asked, what do you need? Transportation was a big one. So we're delivering that. On our core plan, 24 one-way trips from the member's home to their doctor's appointments. On the select plan and on the advanced plan for diabetics, 60 one-way trips, all right? And we do have a mile limit up to 60 miles. And then lastly, you can see the other benefits here, but I like to talk about what sets us apart, wigs for chemotherapy. We really hope that nobody has to use this benefit. But if you've ever known somebody who's suffering from the mental side effects of going through chemo, hair loss, right? We want to be a support to them. So we're providing up to $500 a year for individuals who are experiencing hair loss from chemo to put that money towards wigs. All right. Just another way we're looking at the individual, their whole healthcare journey. Next slide, please. All right, so I just want to go a little deeper on the advanced plan because there are some unique nuances to this plan. So for individuals who enroll in this plan, they are required at the time of the application to complete what we call a chronic verification form. This is a form where they, as the individual, attest that they do meet the requirements to join this plan. CMS does require that we get an attestation from a physician of their choosing, of that member's choosing, an attestation that the doctor or nurse practitioner, whoever it may be, signs off and says, yes, I can confirm that my patient has diabetes and is eligible for this plan. We will be sending those forms to you via fax. We have 60 days to get that confirmation. If within 60 days of that effective date, that member's diagnosis is not confirmed, we will be forced to take them off of the health plan. Now, I have worked with CSNPs before, and I will tell you that I personally will, in partnership with your network team, do everything possible to make sure that no member gets disenrolled because of lack of verification. I will personally, Mike also will, come knocking at your door if we need that signature in order to keep that member on the plan. There are 3 questions that are on that verification form that the member has to attest to. It's, have you been diagnosed with diabetes? Have you had problems with high blood sugar? And do you take medications, or have you put on a special diet to control your blood sugar? Again, they don't have to be on medication to be on this plan. They can be controlling their diabetes with diet and exercise, but they do have to have type 1 or type 2. Next slide, please. All right, so let's talk about the marketing support. So Devoted is very big on marketing and working with our providers to make sure that you have everything you need to help you grow your practice with Devoted. So let's go to the next slide and show you what some of those assets look like. So through your provider portal, you do have access to Southeastern, which is our marketing portal. And there's a special section just for our providers on there. There's a lot of really neat tools that we have available, including things like pull-up banners, posters that you can put up in the practice, trifold holders. You see some examples here. We can bring flyers up to you. I have a bunch in my car I'll be giving to Mike. Just collateral that you can either have displayed in your lobby or you can have out in the back, to provide to your patients when they ask. I do want you to be aware that starting next week, we will be doing quite a few mail drops. So seniors in Yavapai County will be getting mail from Devoted saying, hey, we're a new option for you. This is what we're offering. So keep in mind, they may bring that into your office and say, are you participating with Devoted? You can probably say yes and provide them some collateral if you need. If there's something you don't have that you would like, please don't hesitate to reach out to Mike or myself. Happy to get that to you. We also do have window decals. I think these are super important for awareness, right? This is the #1 issue that new health plans have when they go into a new market. It's, are you contracted with this company? So these window decals are provided to everybody. They're very simple. They just say that we are a participating provider with Devoted Health. I encourage you all to please put that somewhere visible so that your staff knows and your patients know that you are participating with us next year. Additionally, one other thing that's not on here is we do have different types of letters we can do. They're mostly known as affiliation letters. I like to call them announcement letters or awareness letters. These are letters that we can send out on behalf of your office that just let your current patients know that you are participating with Devoted Health. There's a whole library of them. So if you have someone aging into Medicare, you want to do it for AEP, or let's say that you're terming your contract with another carrier and you need to let your patients know about that termination and your other health plans, an affiliation letter or announcement letter is a great opportunity to use that tool. So just reach out to me or Mike if you have any questions on that. Next slide. All right, so I'm gonna give it back over to Mike. But with that said, I appreciate everybody's time and look forward to seeing you all here soon. Thank you, Mike.
Thanks, Nicole. We appreciate you. So we're really at the end of the presentation. Just so you guys know, I will be sending a presentation out and a thank you email. So you'll have all of my contact information nice and handy. Or I can tell you as well, Lisa, so it's pretty straightforward. It's michael.hodges@devoted.com is my email. And my phone number is 928-925-0753. So again, I'll send that out to everybody as well. And I will be working with you guys and following up so that we can go deeper, right? I'll be spending a lot of time with the right person in your organization to talk about how to go into availability and close gaps, or if there's a claim question, things of that nature. So we call that onboarding or in service. So we'll be scheduling those with you guys. As you know, I like to come and see you in the offices whenever possible. I know in some instances that's not available. So I can also do virtual meetings as we're doing right now. And that is really pretty much it. Again, just to kind of follow up on Nicole's ending there, that we really do look forward to growing with you as well. There's a lot of really good, unique, patient-centered type benefits I think that Devoted is offering that I'm not sure a lot of other plans are. So thank you guys all so much. I know how incredibly busy everybody is, especially dealing with reacting to COVID. I know that's a constantly changing battle every day. I cannot tell you again how much I appreciate you taking time to be with us today. And I look forward to reconnecting with many of you and working with you again, and wish you all the very best. And I'll be sending you an email late this evening. So thanks all very much. Have a great afternoon.